Good afternoon. Hi.
Hi, how are you?
Good. How are you?
I'm fine.
My name's Tiffany. I'll be your nurse.
Hi, Tiffany.
I'm going to do an assessment on you just to make sure you're not having any problems. First, I'm going to sanitize my hands with the hand sanitizer.
Okay.
Okay. I'm going to start with your heart. Have you noticed any changes or anything like that?
No, I haven't.
So I'm going to palpate for what we call thrills, which is an pretty much a palpable murmur. So I'm going to start this area, the
Mm-hmm.
palm of my hand, my fingertips. You can see. Okay. Next, I'm going to palpate the point of maximum impulse, which is the fourth or fifth intercostal space. So I'm going to go down and to the left, and I can feel. I don't feel anything that's abnormal, but I do feel that the point of maximum impulse.
Okay.
So now I'm going to listen to your heart sounds. I'm going to listen to your aortic valve, your pulmonic valve, tricuspids, and mitral valve. So the aortic valve is the second intercostal space. So going down to, taking a listen. And that's to the right of the sternum. Next, the pulmonic valve is going to be to the left of your sternum. It's right over here. Okay, and the tricuspid valve is the fourth intercostal space to the left of your sternum. And the mitral valve, which is also your apical pulse, is the fifth intercostal space. So right by your midclavicular line. This way, I'm going to take a listen. Okay, sounds good. Next, I'm going to take a look into the vascular region. I'm going to inspect your skin. So as you're laying, I'm just observing. I don't see any um, bruising. I don't see any petechiae redness. Your hair looks fine, even distributed. No lesions. I'm going to palpate for skin turgor. So I have your hand up here. I'm going to pinch it as like a tent and release it. And it went back immediately, so that's good turgor. Next, I'm going to palpate your pulses. The first, if you're able to swing your legs around for me or to sit up, I can demonstrate your palpating your pulses.
Sure.
Okay. So first, I'm going to do the carotid pulse, which is in the neck area. Okay. Next, I'm going to do the brachial pulse, which is in the upper elbow, right here. Okay, and I feel that one. The radial pulse, if I can show, if you can remove your watch, sorry, is right in your thumb area, and I can feel your radial pulse. Your femoral pulse is in the groin area. I'm just in the inner space between um, where your hip meets and your groin area. The dorsal pedis is at the top of your feet or your foot, and I can feel that as I'm palpating down. And then the posterior occipital is right behind the ankle, and this is what I'm palpating now. Okay, so if you lay back down, I'm just going to assess your nail beds. I'm assessing the capillary refill. So I'm pressing down on the nail bed and seeing if I have a brisk or sluggish refill. And I do have a brisk refill less than 2 seconds, so that's good. I'm going to look at your extremities for edema and temperature. Your temperature is warm to touch, and I'm not feeling for any edema. I'm going to look at your legs. They're also warm. No pitting edema, and I'm able to press, and your skin is not pitting. I'm going to assess for Homan's sign, which is a sign for DVT. And what I'm going to do is grab your leg. Turn this a little bit so I can see you. And fully extend it. And I'm going to ask, okay, everything is an extension. Do you feel any pain while I'm doing this?
No.
Okay. And I fully extended your foot with this also. Any pain?
No.
Okay. All right, next I'm going to check your abdominal area. And right now I'm going to ask you to raise your blouse if that's okay, just up to this area to look at your stomach.
Mm-hmm.
As I inspect, I notice slight scars. Did you have surgery?
Yes, I did.
Okay. But no lesions, no nodules, no distended veins. Your umbilical area looks fine because there's no, the contour is leveled. I don't see any hernias or any bulges or masses. Next, I'm going to listen to your bowel sounds. First, I'm going to start in the lower right quadrant. So I'm just going to listen down here. And then your upper right quadrant for a few seconds. Your left upper quadrant. And your left lower quadrant. And your bowel sounds are all active, so that's good. When was your last bowel movement?
Yesterday.
And your last menstrual period?
Last month.
Okay. And so now I'm going to percuss just to see if it's any abnormal sounds. So I'm just lightly tapping on the different quadrant areas. And I don't feel anything or hear anything abnormal. Okay? And now I'm going to osculate your abdominal vessels. So I'm going to take the bell of my stethoscope and I'm going to auscultate the aortic to the upper region. The splenic artery is in the upper left region of your abdominal area. And your renal arteries also in the upper left. And then the iliac arteries, lower right and lower left. So to palpate, I'm going to lightly palpate your abdominal area, starting with the right lower quadrant. I'm going to take my fingertips, the upper right, the upper left, and the lower left. And now I'm going to do deep palpation. I'm going to use both hands and deeply palpate lower right, upper left, and lower left. Okay, and now I'm going to check for Murphy's sign, which is gallbladder tenderness. So I'm going to palpate right in the area where your gallbladder will be. Okay, and I'm going to ask you to take a deep breath in and out. Deep breath in and out. Any pain or tenderness?
No.
Great. And now I'm going to check for McBurney's sign, which is a sign of appendicitis. So it's going to be on the right side. I'm going to push in. Okay. Any pain while I'm pushing in?
No pain.
Okay. And next I'm going to look for, also for appendicitis, it's called Fayol sign. And what I'm going to do is extend your leg. I can just move this over a little bit. Extend your leg out and rotate your hip in. Are you having pain while I'm doing this?
No.
Great. So, and also I'm pushing on your stomach for any rebound tenderness. And are you having any?
No pain.
Okay, great. So no appendicitis, no gallbladder problems. Next, I'm going to check your musculoskeletal system. And while you're lying down, I'm just inspecting your joints. I don't see any abnormalities just by looking. I'm going to have you sit up. Okay. And so I don't see anything that would be abnormal. So I'm going to inspect each extremity against range of motion against gravity. So first I'm going to start with your head. I'm going to ask you to turn your head against my hand to the left and to the right. Okay, up and down your neck. Okay. And now I'm going to just flex your neck up and down. And now I'm going to ask that you push your shoulders up against my hands. Up and down. Up and down. Okay, and now I'm going to lift your arm up to check your shoulders up and down. Same with this arm. Okay, and now your elbows up, back, up, back. Same with this arm. Up, down, up, down. Now I'm going to assess your wrists. So point, flex, point, flex, point, flex, point, flex. Your knees, same thing. Gonna go in and out, push up against my hand, in and out. Point, flex, in and out, point, flex. Your ankles the same. Push up against my hand, point, flex, point, flex. The other ankle, same. Point, flex, point, flex, flex. And now I'm going to see if you're able to do any rapid alternating movements. So I'm going to have you go like this in and out to see if you could do that quickly. Okay, good. Also, if you can move your legs in and out, very good. Next, I'm going to ask that you grab my hands. Let's see, test your grip. Okay, squeeze. Okay, very good. So your musculoskeletal system was all normal. Okay. The next area I'm going to check is your neurological status. So you have 12 cranial nerves, and the first nerve I'm going to assess is smell. I'm just going to open this cap, and you just tell me what you're able to smell. What smell is that?
Alcohol.
Alcohol. Right. This is hand sanitizer, and it smells like alcohol. The next is the optic nerve, and that nerve I'm going to just test to see if your vision is working. While I'm doing this vision test, I'm going to also check the ocular motor, the trochlear, and the abducens. That's all dealing with your eyes. Okay? So I have a pen light. I'll ask if you remove your glasses.
Yes.
No, my light is shining bright. I'm checking to see if your pupils constrict. Yes, your pupils did constrict. And I'm going to ask that you follow my finger and up to the side. Very good. And ask to see, do you see?
Yes.
And you just tell me left or right.
Right. Left.
Okay. And next I'm going to check your trigeminal nerve. So I'm going to ask that you open your mouth and clench your jaw tight. Very good. And next I'm going to check your facial nerves. So open and close your eyes. Very good. And next I'm going to check your vestibular or ocular nerve, which is hearing. So I'm going to whisper something and you just tell me just repeat what I said.
I love you.
You're great. Very good. And then I'm going to check your glossopharyngeal nerve. I'm going to take my tongue depressor here. If you stick out your mouth and your tongue and the gag reflex. Okay. Next, I'm going to check your 10th nerve, which is the vagus. I'm going to ask that you swallow. Okay. And then The accessory, that's the 11th nerve. I'm going to ask that you move your shoulders up and down. Okay, very good. And the 12th nerve is the hypoglossal. I'm going to ask that you stick your tongue out, move it side to side. Okay, very good. So all your nerves were within normal limits. And next, I'm just going to palpate your face. You can remove your glasses for me. So I'm just assessing for any pain. Your ears, any pain?
No.
Okay. Your hands, I'm palpating for any pain, any sensitivity. Are you able to feel my touch? Same as with the legs?
Yes.
Okay. Are you able to feel?
Yes.
And I'm going to take something sharp and I'm just going to assess if you feel this.
Yes, I do. Yes.
In your feet?
Yes.
Okay. So next I'm going to assess for your plantar reflex, which is called the Babinski sign. So this is when if you can lay back, I'll have your foot extended. It's when I will take something sharp and to see if your toes will curl inward. And I'm assessing it with a sharp object. And I'm stroking it along the outer area of the foot. And yes, yours was normal. Your toes did curl inward. Next, I'm going to check, if you can sit up, for your deep tendon reflexes. So first, I'm going to check the bicep area. And I have my little hammer. So the bicep tendon is right in this area here. And I'm just going to make sure that by me tapping it, you're able to flex. Okay. And next is the brachioradialis, brachioradialis, and it's going to be right in the thumb area, right in the elbow, right in the middle. And what you want to look for is if your hands move up. And I'm going to tap that here. And yes, that is normal. Next, the tricep area, which is in the back of the arm here. And also for this tendon, you want to make sure the arm does move up or flex. So this area I would tap. And next will be the patellar, which is the knee area. And then I'm just going to tap the knee lightly and make sure her leg jumps, which it does. So all of these are +2, which is normal. And the Achilles is the back of the ankle, right at that point. And I'm going to make sure the foot jumps. And that's also normal, which I would say is +2. It ranges from 2 to 4, and the normal range is 2. And so next will be the assessment of the genital area or the rectum area. So the thing that I would do if I was going to assess you is I'd first put on my gloves. And I would ask if you notice any swelling, drainage, or discharge. Have you had any of that?
No.
Okay. So I would pull the curtain for privacy. And I will assess the vaginal area if you've had any drainage or discharge. I will also look for any lesions. I will open up the labia to look for lesions. I would also look for drainage, any swelling. The perineal area, the skin integrity to notice if it's any loose skin or any changes in the skin area. Rashes, swelling. The rectum, also you want to look, you can also take a Q-tip to see if the rectum muscle is active, to see if it closes. I would look for rashes and swelling or any presence of hemorrhoids. And for digital rectal exams, I would lubricate my hands. I would also check to see if you were a male for a prostate exam. Have you to bend over, lubricate my hands, and gently push my hands up and around in a circle. Also assessing for fistulas. The breast exam for female, I would have them to lay on their back and gently assess around, palpating, feeling, looking for any like a feeling of an orange, any warmness, tenderness. I will also ask them when their last menstrual cycle was, and also any changes in their breasts. So that will conclude my physical assessment. I would like to thank you. I'm just going to remove my gloves and sanitize my hands. Thank you so much for your time.
Thank you.
Thank you.